Hi everyone, my name is Christie Amundson. I'm a physical therapist at Impact Physical Medicine, and welcome back to our channel, Impact Your Life, and our pregnancy series. Today we're talking about episode 2 in our series, which is going to be sleeping positions. If you're new to the channel, welcome. We are going to be uploading weekly throughout pregnancy from about 20 weeks on, trying to discuss common questions, concerns, topics that you may have in the pregnancy or postpartum period, so that you can focus on the more important things like the excitement of your upcoming arrival or your newest arrival, and maybe less on the discomforts that you have during pregnancy or the postpartum period. Last week we talked about pubic pain, and today I'm coming to you from my bedroom in my comfies because we are going to be talking about some sleeping positions. So first things first, from about 20 weeks onward, it is recommended that you sleep on your side, right or left side, compared to, obviously, it's kind of a no-brainer that it's not very comfortable to sleep on your stomach anymore because of the size of your belly and your breasts growing. However, they do not recommend, it's not recommended to sleep on your back, and that is because with about 20 weeks and onward, the size of the baby, the weight of the baby, and the uterus can compress, if you lay on your back, the large vein that brings blood back up to your heart. So obviously, you want to try to avoid that, and that is why they recommend that you sleep on your sides. Right versus left side, it is preferred, if you're comfortable on both, to sleep on your left side. And it's really for that same reason. That vein that's coming back up actually runs along the right side of your abdomen in the back. So sleeping on your left side just gives that vein a little bit more space. Although if you're someone who kind of has to toss and turn at night and flip sides, or it is actually good for your body to be able to switch positions every once in a while. Switching from right to left is the most safe during pregnancy, as opposed to going to your stomach or your back. So if you are someone who cannot sleep in any other position other than your back, or if you have terrible acid reflux or heartburn issues, stick around, because at the end of the video I will give you some options for sleeping on your back that are a little safer and less compression to that main vein that we talked about. But for the reasons that we just talked about, most of the things that I'm going to talk about and show today are going to be side sleeping positions. There are tons of pregnancy supports and pillows out there. I have a few of them to demonstrate here, but certainly not all of them. There's lots of options out there. And then honestly, if you don't feel up to, purchasing something, big body pillow or support pillow for pregnancy or afterwards, you can do all of what I'm going to show you with regular pillows from your bed. You may have to collect a few more than just the one or two that you may be used to, but I'm going to show you how to do that as well. So I do have regular pillows. I have a wedge maternity pillow to show you, and then I also have this Snuggle pillow, which is a maternity pillow. It's kind of a C shape, or I guess it's more kind of like a J shape at the bottom here with this curve. And then the top is straight across. So I'll be showing you some things to use for both. If you have a pillow, something like this, it doesn't have to be this exact one. It could be one of the longer body pillows as well. And then without it as well. All right, so let's get started. So I'm going to show with this Snuggle first. So the bottom part of the Snuggle, like I said, is that kind of J piece that comes around and up. Generally, you want that toward your feet. And I also, this is of note because, like I said, you're going to be, you may switch from side to side. It is preferable that you sleep on your left side. Most of what I'm going to be demonstrating is going to be on my right side, more just because of logistics in my bedroom here and to be able to show you guys this. But please know that you can certainly do it on both sides, and if it's comfortable on both sides, it's preferred that you do it on the left side. So this Snuggle can go both ways. It can go behind you. So in other words, this long piece here can go behind you, or it can go in front of you like this. Sometimes it just depends on how you like to sleep. So if you sleep on your side, usually people like to sleep in one of 3 different positions. They'll sleep pretty much vertically right up on their side with their hips kind of stacked on top of each other, shoulders stacked. Some people like to kind of roll forward when they sleep on their side. So it's sort of like, you know, partially on their stomach, partially on their side. And then some people prefer to lie that same way, but in rolling back. So partially on their back, partially on their side. So I'm going to show you some different options for all. So if this is behind me, again, the J piece is at the bottom toward my feet. I'm going to lie down. My back is going to go right up against this long pillow in the back, and I'm going to split my legs apart, and this J piece is going to go between my legs like this. This piece in the top is going to be my pillow for my head. So it would look like this. So I like this option for a couple reasons. The piece in the back prevents me from, while I'm sleeping, rolling to my back accidentally. So it does that. It also is it's a nice support for my back if I'm someone who likes to roll backward, like we talked about. So this would be good for someone who likes to be, you know, again, pretty stacked sideways, as well as someone who likes to be kind of rolled backward, because again, it provides some support for my back. If when I roll backward, it's a little bit uncomfortable for my hip, in particular, I guess either hip, but especially this top hip, or for my pubic area, what I can do is I would add another pillow. I do want you to notice that when my feet are stacked like this, both my ankle and my knee are on the pillow. So I wouldn't want to be like this, where my feet are together and my knees are apart. So that actually torques your hips a little bit. You do want, in order for your hips to stay in a kind of more neutral position, you do want both your ankles and your feet to be supported by the pillow, as well as your knees. So if I put a higher pillow in, if I'm someone that likes to roll back more, kind of like half on my back, half on my side, I may want to prop my knee up a little bit more with another pillow. And when I say knee, I mean knee and ankle, like this. Also, if I'm rolled back, I may, if this, sometimes the weight of the baby, especially if you're further along, can kind of pull on my back. So if doing this kind of bothers more my back, I'll want to maybe prop, I can fold up a towel and put it under here, or I can use a pillow, or like that's what the purpose of this wedge pillow is for, is to kind of put it in here like this to prop up the side of your abdomen so it gets some support. So this is pretty comfortable for me. I also, if you're having still some trouble in your hips, you could actually add, because I'm rolled back like this, I could add an additional pillow under here. Like this. So now, I may or may not need that pillow, but now my legs are kind of up at an angle, as is my torso and my body. So when I lie like this, and I may or may not need this pillow to support my abdomen, but it helps both hips kind of stay in line with my pelvis, as opposed to being kind of turned or torqued. So you may need to play around with the size of the pillows and what's comfortable for you. But typically, if it's hurting your back, look at supporting your abdomen a little bit more. If it's more hurting in your pubic area or in your hips, look at the angle of your pelvis. So if I'm rolling back, my pelvis or my hips would be pointing more up toward the ceiling a little bit, which my legs should be as well, so that they match. If my legs are pointing straight ahead at you guys and my torso is rolled back this way, oftentimes that can kind of pull or torque in your hips or pelvis and is not the most comfortable thing. So that's an option. If you're someone who likes to roll forward more, I would recommend having this this pillow turned around like this, and you can do the same thing. You're going to put the pillow between your legs, and you're going to snug this long piece, kind of tuck it underneath your abdomen so your belly has a little support. And it also prevents you from really rolling really far forward onto your stomach at night. So you could be like this. Again, with me leaning forward like this, I do want my ankles and my knees on the pillow, so I would not want my feet together like this. And again, you may need to experiment depending on how this feels with the size of this. So this may be enough for you, or if you're getting some hip or pubic pain, you may want to prop it up with another pillow like that. Again, the benefit of this long piece is it prevents you from rolling forward onto your stomach too far, but it also provides some support for my belly underneath here. If I don't have this nice large snuggle pillow. Oh, actually, I'm going to show you one more thing with this. I forgot. If you're someone who may have this pillow, but for me, for example, this isn't that comfortable for my neck, using this snuggle pillow. So I prefer to use my regular pillow for my neck. So what I use this for is a little bit more unconventional, I guess, but I fold this down like this. So I am someone that likes to roll forward when I sleep. So if I stack this on top like this, now it just made it thicker, right? And then I can use my regular pillow here. So I actually, so you can do this, but I actually take the tail piece of the J, and I pull it up actually underneath my abdomen. And then I still use it kind of doubled over for my legs. And that helps with my pubic pain. And I also sometimes will get like a groin pain or a hip pain or pinch if I don't have enough support with my legs. So again, I want just as much support under my ankles as I have under my knees. So again, if I have my feet out like this, that would mean my legs are kind of more turned out. If I don't like curling them back over on the pillow, then I'd want to put something down here between my feet, to just like another pillow or whatever, to keep them split apart so they don't fall in like this. But this is how I actually use this pillow. And it makes it a little bit easier to negotiate too if I'm rolling side to side. One of the biggest downfalls with this pillow is, obviously it's very large, so it takes up a lot of room in the bed, but it also, it's a little bit hard to roll side to side. So I would say, typically that's the biggest complaint we hear about people, like, I love this pillow, but it's really hard if I want to move side to side, especially with a sheet or a bedspread over you, to try to, get everything situated when you're turning over. You could leave it, one direction and start this way, and then if I just flip over in the bed, then I'm going the other way like I demonstrated, and just leave the pillow alone. So that is an option. Okay, if you don't have this pillow, you can do a lot of what I just showed you without that pillow. Again, the downfall is you don't kind of have that fail safe of something that's going to block you from completely laying on your back or completely going to your stomach at night. But you could use pillows. If you're using pillows, remember, a lot of people will curl their feet back and just put the pillow between their knees like this, and their feet are still together back here. So it's again torquing your hips out instead of supporting them in a neutral position. So just make sure the pillow is between both your feet and your knees. So if you like to curl them back, just bring the pillow with you. So again, One pillow, again, depending on the thickness of your pillows, that may vary, but this is going to be fine if you are someone who likes to kind of stay stacked. Again, if you like to roll backward, you may want to put a pillow behind you to kind of serve as kind of what that snuggle was doing, to prevent you from rolling all the way back, but also give yourself a little support. And then you also are probably going to want to, or may want to, prop your legs up a little bit more. Again, because when I roll back, my pelvis points more toward the ceiling, as should kind of my leg bones. If I'm going forward, just the opposite, I may want to hug a pillow here. Again, that serves to help both support my belly in the front and prevent me from rolling all the way forward onto my stomach. So the biggest thing is have a lot of pillows, try a lot of different things, see what's comfortable for you. Everybody's going to be different. So those are the options for side sleeping. I wanted to show you a couple options, or one main option for back sleeping. So if you're someone who has terrible reflux, or if you're someone who just can't sleep on their side for whatever reason, you can sleep up in an incline. So some mommies-to-be choose to sleep in a recliner actually. The biggest thing is you want to make sure you're at least 30 degrees inclined. So if I take this kind of wedge pillow, and I actually had this from the clinic, but you can get these at like department stores, and like a Target or a Walmart usually carries them. This angle is about 30 degrees. So you would not want to be flatter than this. So if you have something that you get at the store that can be this way, or you can kind of build yourself up like a little pillow wedge here. Just be cognizant that if you're building it up with pillows, your torso is going to be heavier than your head. So when you lie on it, make sure that your torso just doesn't sink down and it's pushing your head really far forward, because obviously that would not be desirable. So if you're doing this, you're going to want to prop your feet, put a pillow underneath your knees, and you're going to want to be up so the bottom of the wedge comes close to your hips. And you may want to, depending on how you're setting this up, use a pillow here like this. So again, about a 30-degree angle can help. If you're someone that isn't going to sleep in a recliner and isn't going to sleep with all of these pillows, I know a lot of times people will come and have pretty bad reflux. We'll need to start out in something that's a little bit elevated but want to move side to side. One of the things that I know I found really helpful is even just propping the legs of your bed. So the two legs from the head of your bed up with like a 2-inch, 3-inch, like a 2x4 or a piece of wood. We did that with our bed. It's pretty subtle. So to be honest with you, we did it 3 years ago in my pregnancy, or my last pregnancy, and we kind of forgot about it. So it's still there. So it's come in handy for this pregnancy as well. But again, I think they're called, I'm not very mechanically inclined, but I think they're called shims, that you just grab little pieces of wood. You know, might want to have your partner help you out, but prop up just the head of your bed. A lot of people talk about putting things under the head of the mattress. You could do that. You get a little bit more of the Princess and the Pea effect if you do that way. I find it's really much more helpful if you can prop from the legs of the bed. And again, it's not really noticeable, but noticeable for if anyone else is sleeping in your bed, but it is, it's a lot of times just enough that can really be helpful. All right, so hopefully this was helpful. If you found anything in this video helpful, if you could please like it and subscribe to our channel, and you can get the updates and notifications as we continue to upload new videos in this series. Thanks for watching, and we'll see you next week.